most common is the polyuria and nocturia. A young person, a young adult to middle age, anyone will come, most often they will come with the history of polyuria nocturia. That means they have to visit the bathroom for passing urine more frequently, and it is sometimes, many times, it is disturbing their sleep. Usually an adult will go to washroom before going to bed, and usually they may not get up in between till next day morning, or at the most once. But an undiagnosed diabetic patient, that means uncontrolled diabetic patient, will have to get up frequently during the night and as well as during the day too. This is the most common symptom which directs us to suspect that he is suffering from diabetes, and when we test, more often it will become positive. And the second one is polydipsia. The person feels thirst, unduly excess thirst. That means hitherto he was not having such a thirst, but now the person for the last few weeks or few months, he will be suffering from this excess thirst. Every hour, every second hourly, he wants to have some drink, some cool drink, some chilled drink or chilled water. So he is surprised. It will be surprising himself or herself that why he or she is getting so much thirst. Feels like drinking more water. So this is the second most common. And third is the fatigue. A person who was hitherto working from morning till evening till his or her duty is over, was not having any kind of fatigue or tiredness, starts developing feeling tired in the middle of the duty hours or before the end of the duty hours. Before that, he or she was returning home from his or her duty without any tired feeling. This is the third most common symptom of diabetes. And these are the symptoms which bring them to the doctor consultant, and when we test it, we'll suspect it, and when we test it, almost always they become positive. That means the diagnosis will be made as diabetes. These are the three most common features. Of course, there are many other to go on, like obesity and balanoposthitis and pruritus vulvae in women. But since the question was only three, for three most common, these are the three. That is polyuria nocturia, that means visiting the bathroom more often during day as well as during the night, and polydipsia, getting thirst unduly frequently and excess thirst and forcing him or her to take water more. And third is the fatigue, tiredness feeling, which was not there hitherto. And my suggestion in this context is anyone who is above 30 should undergo routine health checkup annually without any symptoms also, because diabetes has become very, very common, and it is better to diagnose it and start treating and controlling it before it produces any of these symptoms, either the mentioned three or the many other symptoms which it will cause. Forget about the complications.